Yes, good evening, everyone. How are you? You're welcome. The time is 7:59 p.m. By 8 p.m. on the dot, excuse me, by 8 p.m. on the dot, we are starting. Now, I'm currently live on um, Facebook and I'm live on TikTok. Yes. So if you're just joining me, you're welcome. Tell me where you're joining me from. Everybody, tell me, where are you joining me from? Let's go. Let's go. Where are you joining me from? Where are you joining me from? Everybody, good evening. I have Chris on TikTok, Jane on TikTok. Hi, Mogaji Leo. I see you. Olive Branch. I see you. Holy Molly on TikTok. I see you. Oge Ume from Anambra. I see you on TikTok. And on Facebook, we have Medinat Nasiru joining us from Egypt. Mogaji is joining us all the way from Lagos, Nigeria. Rita from Italy. Area 1, how are you? We have about 40 people on TikTok tonight. Are they in the building? Are they from Lagos? Okay, good evening. Those on Facebook, how are you? Now it's 8 p.m. on the dot. So this is Ask the Doctors every Sunday, 8 p.m. West African time. We have this program. My name is Dr. Frederick Unuigbokhai. I always tell you good life now. Sent. I'm not alone. I have my co-host joining me on the program, Dr. Israel Robono said, Dr. Blessing Arimir. We come together every Sunday like this to have the program. Now today's program, it's a question and answer session. So you can drop your questions and we'll do our best to respond to you. Now, remember, we don't prescribe here, that do we make diagnosis. All we do here is just to advise you. Are we together? And I want to make one appeal. Please help me share these videos. Help us share the videos. Share the videos, tag your friends, and let them come join us. So on Facebook, we have Maria from Lebanon, Judy, good evening. Mary from where? Mary Rose, how are you? Faithful, how are you? Uduak, Udo, Uzoma, PLPR. PLPR is going through some physical or mental challenges. I don't know. So I will advise you. PL on TikTok has a problem. I think so. So, ladies and gentlemen on TikTok, help us advise PL to go seek mental counseling. Kalista, how are you? Chris, how you did? So we have a question already from Onyinyechi. Onyi, where are you joining me from? Onyi just enter the house. Onyi no even tell us anything. Onyi just dey ask question. Now wow, now so you be. You just enter nothing, no good evening, no I'm joining you from here. The next thing a question. Now so you be. Ah, wow. What is the cause of chest pain? There are many things that can cause you chest pain. Hmm? Many things can cause you chest pain. It could be from the muscles, it could be from the bones, your ribs, it could be from your lungs, it could be from your heart. Yes. So there are many causes of chest pain. It could be trauma, it could be infection, it could be metabolic conditions, So there are many things that can cause chest pain, madam, and I can't tell you what is causing your chest pain. Faith, good evening. Holy Molly says, how do you differentiate a placebo from a miracle? Your question is not medical, my guy. Hmm? Your question is not medical. So your question should be directed to a scientific community. Yes. Emmanuel from Abuja. I see you, Emmanuel from Abuja. Taiwo from Lagos. Onyi from Netherlands. Idowu says, keep up the good work. Yeah. Now, I want to say thank you to someone. One of my followers on Facebook actually got my account number and sent me money. Now, I don't know if you are here. The person is, they sent me the name. So I want to say thank you very much um, to this person that made that transfer. He just sent the money like that, nothing, not for consultation, for just saying thank you. And I got the message and I'm saying a very big thank you. Thank you. What advice for someone trying to lose weight? I made a video on that, Lanita. You can go to my page and watch the video on TikTok. Hmm? What causes migraine? Oh, migraine is a severe form of headache. Please share this video. Share this video. Share, share, share. Share the video. Migraine is a severe form of headache. Most time, the exact cause is not known, but there are trigger factors. There are things that can trigger your headache, your migraine headache. Huh? There are things that can trigger your migraine headache, like stress, lights, and noise. So you should know what are the triggers of your headache. You understand? Yes. Okay. Okay. Good evening. Please, what is the cause of spleen enlargement? This spleen can enlarge due to malignancy, due to infection. Malaria can make you have spleen enlargement. Hematologic disorders can make you have spleen enlargement. So if you have a spleen enlargement, I think you should be seeing your doctor. What should one do with low libido? Do low libido. Low libido. Well, okay, so advice number one, advice. You should be seeing a doctor. Number two, you might need to check your hormones. Check your hormones. I'm not prescribing for you, so I'm not going to tell you the hormones to go and carry out on social media. Check your hormones and find out your lifestyle. Are you stressed? Are you having issues in your relationship? You and your partner gonna get challenged because if una no dey in good terms, if it still affect your libido, stress, hormonal changes can also affect your libido. Yes. Amaka, Madam Amaka, good evening. I'm live on Facebook and TikTok. Um, we have a comment here from Bathsheba Emmanuel on Facebook. I always feel tired and severe back pain. What could be wrong, please? I visited hospital and they put me on therapy, but it didn't work. Still having the pain and tiredness. Advise me, please. Ah, when you say it didn't work, what did they really say is the problem? That's the most important thing, eh? What exactly is the problem? What did they diagnose you of? Do you get? And when you say therapy, what therapy? Always feeling tired. What did they do for you? Is it that you are not eating, you are stressed, you have anemia? Why are you feeling tired? Hypoglycemia? What is it? What did they check you for? And then your back pain, what did they do for you? How does polycythemia vera influence the cause of Buercher syndrome? This is not a medical class now. What think it is? Who be this? Holy moly. You're a medical student or a medical doctor, I guess. This is not what you discuss in public forum like this, guy. I have been told about stress by medical personnel, but I don't even stress much to cause migraine. And there might be other things that might be causing your migraine. There might be other things causing your migraine. Yes. I'm live on Facebook and TikTok. Evening, doctor. I have pain in my scrotum. What could that be? Francisco, you're having pain in your scrotum. I can't say what that could be, my guy. The scrotum, it could be from the testes, it could be from the blood vessels around that place. So if you're having pain in your scrotum and the pain is increasing, my guy, they might need to check your scrotum so that you don't develop what we call torsion, testicular torsion, torsion of the testes. It's a very bad stuff. So if you're having pain, find out, is there any trauma? Are you feeling any hotness around that side? Is there any swelling? These are very important stuff that your doctor will need to know. So if you're having pain there and the pain is not going, has been there for a while, I beg you, let them check your scrotum. On Facebook, good evening, doctor. Okay, I've answered you on the spleen. Uh, good evening, doctor. Can I take molcosan medicine while I have stomach ulcers? My answer is no. I'm not going to support your prescription on my page. You should go and be discussing with your doctor privately. We don't prescribe medicine on social media. Please advise on arthritis. What are the preventions? Arthritis has no cure, my guy. Arthritis have. Thank you for the gift, for those on TikTok sending me gifts, flowers and the roses. Thank you very much. Those on Facebook, You can send stars too. So arthritis has no cure. Um, it's a degenerative condition that affects your joints. You can try to delay the progression, ensure your joint is not stiff. You need to do little massage, physiotherapy, and pain medications, really, but it doesn't have any permanent cure. I have been checked. They said the fetus is okay. You can come to Facebook. Oh, I'm not seeing some of your comments. Though I was placed on aspirin tablet and Clexane injection. Madam Amaka, I'm not getting your comments completely, so I'm missing it. I have missed your teaching a lot. Where have you been? I've been here, though on and off. Love, Onyi, how are you? I have a friend who don't want to take COVID vaccine. How can I convince him to take it? Um, if you are not, if you are not, ladies and gentlemen, please help me address this person, Pearl PR2. So Pearl PR2 is on TikTok, and this Pearl PR2 is going through maybe mental challenge or a spiritual challenge. I bet make una advise am, eh? If the person get problem, make he look for where he go get in problem, not on my page. I'm not gonna block you. Trust me, I'm not gonna block you. If I block you, the body goes with you. So make you just stay here, but we're gonna ignore you. So your friend does not want to take COVID vaccine. Your friend doesn't want to take COVID vaccine. Well, you might try, and yet the person would not still want to take the vaccine. Somebody's asking us a question on Facebook. Doctor, what is the cause of stroke? Stroke is caused by blockage of the blood vessel to a part of your brain or rupture of the blood vessel around a part of your brain. So stroke simply means that the blood supply to the brain has been deprived of blood supply. The deprivation of the blood supply could be due to blockage of the blood supply or rupture of the blood vessel. One common cause of stroke is high blood pressure. Hmm? Sunday Emmanuel, good evening. Please, what is the cause of waist pain? And there's these dark patches on the back of my neck. What should I do? For waist pain, I have made a video on waist pain, and the video is on Facebook, on TikTok, on YouTube, on Instagram. There are many causes of waist pain. Your age, the kind of job you do, the kind of job you do, trauma, compression, degenerative changes. These are things that can cause you waist pain. So you might need to see your doctor. And then if you have a dark patch at the back of your neck, I don't know what it is. I don't know what it is, and I can't tell you what to do. So if the dark patch is itching you, you might need to see a doctor. Let them check that patch. What could be cause of chronic pile and sometimes stolen blood? What do you mean by chronic pile? Pile or no pile? Pile means that there is a weakening of your anal cushion. Your anus gets cushion like shock absorber. When it becomes weak, it will come out from the anus. It will cause you pile, or what do they call, or we call it hemorrhoid. Some of the symptoms include pain, blood in your stool. So if you are seeing blood in your stool and you think you have pile, maybe na constipation, maybe na family history, maybe na the kind of job where you do. Some kind of job can make you develop pile. So if you know you're having pile, please see a general surgeon. A general surgeon. Yes. Okay, this question is here. Finally, let me address this question. Frida says, Doctor, good evening. Please, can I use hydrogen peroxide to clean my ear? Frida, very good question. Indeed, yes, we use hydrogen peroxide, but there is a but. Amaka is here. Amaka, drop your comment here. Madam Amaka, drop your comment on Facebook. But if you use hydrogen peroxide and you don't know how to use it, you will damage your ear. There are many things online, and we are very careful with the things we say on social media, because you might use this stuff, and instead of helping your ear, you go spoil your ear by yourself. Yes, they use hydrogen peroxide to clean the ear, but at the same time, if you don't know how to use it, and you put it in your ear, you go damage your eardrum by yourself. So that is why I kept quiet on that. You understand? Are there harmful side effects of taking COVID vaccines? You get the answer is on online, my dear. Go to WHO page, go to the CDC page. Where again can you get information on COVID? You have the answers there. We've gone past that. Yes. What causes pinkish discharge? Pinkish discharge where, madam? Good evening. What kind of food can A positive eat? Eat any food, my dear. I beg, I beg, I beg, I beg, I beg. If you are A positive, B positive, O positive, eat any kind of food, oh, I beg you. I don't prescribe medications on my page. I dey shit blood. Go to hospital, madam. If you dey shit blood, you should be at the hospital. You should not be on social media looking for treatment online. You should be at the hospital right now if you dey shit blood. I beg you. They didn't tell me what I was diagnosed of, and I tried to read the X-ray result, but I couldn't understand what was written on the result. But the therapy I was receiving was massage. So listen carefully, guys. Whenever you go to the hospital, Alpha, help me open this thing. Hello? Help me open this thing, I beg. Whenever you go to the hospital, always ask them what is my diagnosis? What are they treating me for? It's not right that you just go there, they ask, nothing they go on. No, it don't make sense. I beg, you should find out. Open it for me. Yeah. Please, can you tell me a good medication for worm? I know they prescribe certain medications, but for worm, depending, you can use albendazole or mebendazole. That one is everywhere. Go to the pharmacy and you can get it. Rachel Moji, good evening. How are you there? How can someone cope with dementia? You might need to discuss with a neurologist to understand the severity of the dementia. Then you know how to cope with it. Yes. How do I boost my egg? My PCOS and hemorrhagic cyst is not letting me get pregnant. Madam. I believe you can hear me, Abby. You have PCOS, you have hemorrhagic cyst. Sorry. You are looking for how to boost your egg on social media. Madam, you want to enter one chance, oh. You should be asking your gynecologist, oh, if indeed you have a problem with your egg. You have PCOS and you want to boost your egg. You want to give yourself a problem. PCOS is something that polycystic ovarian syndrome. You should not be looking for this on social media. Rather, your gynecologist should be advising you. You have hemorrhagic cyst, you have PCOS, you want to boost your egg, you're looking for medicine online. We don't do that, and I can't do that for you, and I won't do that for you. I will advise you to discuss with your gynecologist, who knows what is happening to you, and how to advise you accordingly. So sorry, PCOS can be very disturbing, I know, but please speak with your gynecologist. How can someone cope with waist pain? Massage and reduce the cause or whatever that is causing you waist pain. Massage and rest your waist. The kind of job you do. Madam Amaka, I started sporting. So on Thursday nights, Friday morning and Friday nights, I went for checkup and the doctor said my baby's heartbeat is fine, that I only need a bed rest. Though I was placed on ancloxetine injection. Though I'm just bothered because of the previous miscarriage. Okay. I want to believe that you are seeing an obstetrician. What I think they should do is that they should place a close monitoring on you. Do you understand? Yes. Okay, Dr. Israel is here. Dr. Israel, how far?
Fine. Good evening. I'm sorry I'm a bit late. I'm not at home. I came for a program, so I just have to steal away myself from this stuff so that I can just join up.
Welcome. But you can hear me, right?
Thank you. Yeah, I can hear you clearly.
You can hear me. Okay, good. Welcome. So I've been attending to some questions, and let's take some. So somebody's asking us on TikTok,
Okay.
I measured my blood pressure with electronic and manual. They both showed different values. Which one? Okay, you're concerned about your electronic blood pressure and the manual showing different values. Which one should I take? Or would you advise this person, Dr. Israel?
Okay, most of the time, there are so many factors that can affect the both of them. Human factors will mainly affect the manual type, while your electronic, the electronic one, your battery and all that, likewise, can actually affect that. So if the battery is not really working well, you may not get the correct result. However, two of them will never give you the same result. Two of them will never give you the same result. To know if they are really correct is at least they will have a little discrepancy, just a very little discrepancy, which will not be more than 10 millimeter per mercury, 10 millimeter mercury at least, will not be more than that. So when you see that for both of them, you know that yes, you are getting the correct answer. And also you should also know that even in the manual, two different persons taking your blood pressure may not likely get the same result. The only difference, as I earlier said, a little discrepancy can still be there and it's okay. The major thing is so far you are within the normal range of blood pressure. When you are within the normal range of blood pressure, for the two, it is no problem. It is no problem. However, if one is giving you very high stuff and the other one is giving you low, you need to. It would be nice. It would be nice to follow the manual. I think it is better to follow the manual than the electronic, especially if the manual is taken by a professional, someone that is it is someone that is good in taking BP, a nurse or maybe a medical doctor. Yeah.
Yeah, welcome everybody on TikTok and Facebook. Good evening. This is your first time. You are welcome. My cap is somewhere. Someone is asking us a question on TikTok again. This is from Pretty, no name. Pretty, okay, Pretty. The right side of my breast is itching me. What do I do? Let's advise her quickly.
Right side of your breast. Which of the breast? Because is it the left breast? Is it the right breast? Because the two breasts will have right side. So with that we will know. But itching you, is it occasionally? Is it always? Is there heat in that environment? Is that the only place that is inching you? The other part of the body that is inching you? Is there anything you do before you notice the inching? So these are some questions you will need to answer. And also you should know that even when you give us these answers, we will only tell you what to do. We are not going to prescribe medication for you. You should know that. You should know that. And I don't really think it's something serious that you should be scared of, having just that inching. If it's just an inching in one part of it, I don't think you should be scared of it. Maybe something beats you there. It can just be an insect that beats you there. That can also cause that kind of itching. But if you try to do self-breast examination and you notice something different, and then you can now need to see a specialist that can take you.
So let me just add quickly. So she says other parts of the body is itching. So if other part of your body is itching you, you see these are very important things your doctor will need to find out. So you need to see your doctor because you are just telling us my breast is itching me. And remember, now you are coming up again saying other parts of the body is itching you. So you will need to go see your doctor. Dr. Israel, there's a comment here. Now, this person has been following this page for a very long time. He says, I started sporting on Thursday night, Friday morning, and then on Friday night, I went for checkup. And the doctor said my baby's heartbeat is fine, that I only need a bed rest, though I was placed on aspirin and Clexane injection. I'm just bothered because of the previous miscarriage. I'm still going to see my doctor, but what do you suggest? I'm just disturbed. It's giving me an emotional trauma, like PTSD. The aspirin tablet is a blood thinner, yes, we know, because the doctor said my blood is kind of thick. What other advice would you want to add for this person?
Well, if you are pregnant, I want to beg you. I don't know who the doctor you went to see, but I want to beg you, if it's not a gynecologist, please run to see a gynecologist. You're pregnant. I don't know your gestational age. How many months you are as at now. I don't know. However, if your doctor you are seeing is not a gynecologist, please run to see a gynecologist. I think that would be the best advice I will give to you. I don't know why you're saying the blood is clotting, giving you
Yeah.
aspirin and cleansing. It's not. I don't know, but I think you should see a gynecologist. That's the best thing. That's the best thing you
Oh,
can do for
okay.
yourself as at now.
Okay.
Yeah,
It's
that
a
bed
it's a
rest
guy
is very
it's a
wonderful.
gynecologist. Now, okay, no problem.
Okay. Okay, if it's a gynecologist, no problem. The bed rest is actually a very wonderful thing that you can do, and the bed rest is superb. Huh?
Okay. Thank you. Thank you. One more question on Facebook, then we go to TikTok. Doctor, good evening. My genotype is AS. Can I get married to AS as well? Ella. Uh,
Ella, if you want to get the answer, I think Dr. Fred have a video on this. You can actually watch the video, and I think you'll get the full picture and everything you want to know. But if you think you and your husband have the money, the capacity, eh, and your love is as greater than anything, even I will not say love. You have the capacity, financial wise, you can go ahead. But I want to give a kind advice, eh, that we'll normally give to everybody. It is not advisable for an AS to get married to an AS. It is not advisable. As at now, it's still not advisable. Maybe tomorrow it will, but as today, it is not advisable. So I want to say, please, look for an AA to get married to. Love is not only come and stay with me. Love sometimes can mean go and get a better life. Yeah?
okay. What Dr. Israel has said, if you know you have the financial power, financial means, you are very rich, like Dangote, there are certain procedures that can be carried out on you while you are pregnant, or you can go for IVF. But if you know that you are poor, Sakpa, I'm sorry, you're not poor. Sakpa still they drag with you, you know, get excessive money. You see the hustle. Don't try it. Do not. But if you know you are very rich, you can go for the procedures. While you are pregnant, they can carry what we call the genotype testing for your baby, or they carry the IVF, carry out IVF for you. On TikTok, somebody is asking us a question. Good evening, sir. My chest is beating fast, fast, and my chest is paining me too. Okay, let me respond. Dr. Israel is busy. My brother, your chest is beating very fast. You're having palpitations and you are having chest pain. I think you should be seeing your doctor so that you get checked, examined, and then can find out what is causing your problems. If you're having palpitations coupled with chest pain, maybe angina, I don't know, you should be seeing your doctor so that they can check you, examine you, maybe carry out any investigation on you to know what is going on. But you shouldn't be looking for treatment on social media. The reason we are here is to advise you and ensure. The doctor said there is nothing wrong with me. Did they carry out any tests for you? Did they carry out any tests on you? What medications did they give to you, my guy? If the chest is still paining you after seeing your doctor, you have the liberty, you have the option to go see another doctor, my brother. If you see me and my treatment did not help you, you have the liberty and you are in your rights to go see another doctor. So please, my guy, no vex. I think you should see another doctor and most likely a physician. Yes. Another question. Okay, Israel is okay, busy. Good evening, doctor. Please. Okay. We have a question here. It says, good evening,
Okay.
doctor. Please. Is it good to eat too much egg when you are growing old? Dr. Israel, your network. Is it good to eat too much egg when you are growing old? My answer will be no. By the way, you are not qualifying what you mean by too much egg. One egg contains about 200 milligrams of cholesterol. So when you say too much egg in old age, no, we would not encourage you to do that. Rather, we encourage you to take more of fish, more of fruit and vegetables. So growing old, no, I would not encourage you to do that. Okay, I'm in Germany. Yes. Please, Madam Amaka, on Facebook, I would encourage that you have frequent interactions with your doctor. Please. You've had miscarriages in the past, and I know that you are very, very, very scared. You're bothered. You're having anxiety right now. It's not out of place. Please discuss with your doctor again. If you need to be on bed rest, please be on bed rest. Go for your regular checkup, and I wish you all the best. Good evening, doctor. How do I stop watery sperm?
Okay, when you say watery sperm, what do you mean? What do you mean by saying watery sperm? Have you gone for test, investigation, and then I tell you that there's no spermatozoa in the semen? Before you can be thinking of what you are saying. So if you have not gone for any investigation, please, you cannot be saying what you just said. So I don't think, for me, just go to the hospital and do some, and meet a urologist and do some investigation, talk to the person, and you'll be shocked that you don't even have what you think you have. So don't try to stop what you don't have.
Somebody say genotype is a no goal, my love. Okay, let's take another question. Good evening, doctor. Okay, please. Can polycystic ovarian disease be treated?
Polycystic ovarian disease, polycystic ovarian syndrome is a syndrome actually. So it's something we can manage, and it's something we can manage, and you can be pregnant and get everything and have as many children that you want to have and live healthy as possible. Yeah, that's what I think I can tell you on that. Telling you whether it can be cured, I don't think I have the answer to that. But what I will tell you is that yes, it can be managed, and you'll be able to have your children when it is time to have children. Yeah, and whatever that needs to be lower can be actually reduced. But you just need to be on some medications to make those things happen. And you must be a friend of the gynecologist. What I mean is that you should always visit your gynecologist on that regard.
Please, ladies and gentlemen, on TikTok and Facebook, share this live stream. Share the video. People should share the video. Share. That is how you support us. Yeah, you cannot just be asking us. We are answering you. You're not even supporting. You understand? It makes no sense at all. Support us. Somebody's asking us a question here. Let's see, which one do I take now? Good evening, doctor. Please, what about serious chest pain? Immediately after drinking cold water, you develop serious chest pain. What would you advise, Dr. Israel?
Immediately after drinking cold water, you have serious chest pain. That might just be angina. So you just maybe you go for Dr. Fred, please, can you answer the question? Sorry, please.
Oh, okay. So you're having serious chest pain after taking cold water. My first advice would be that you should stop taking cold water. That does not mean that the cold water is bad. There are people who take cold water and they have no problem. But for you, number one, stop taking cold water. Number two, you have to be examined. It's obvious that the cold water is triggering something like a sympathetic response. That sympathetic response is causing you certain type of pain. So you need to be examined. Let's be sure that there is no other problem going on with you. So first of all, You stop taking cold water, please. Then get yourself examined. Now, let me also say this. There are people that always say cold water is bad, cold water is bad. Because it is bad for you does not mean it's bad for every other person. You understand? Because whenever you take beans and you develop heartburn, that does not mean beans is bad. Beans causes heartburn for some people, while for some others, they have no problem. So for you, sir, ma, stop the cold water and let your CVS and your chest be examined. Yeah. We have so many questions here. How many moments do we have? Um, sorry for missing out. I will watch the food. Okay, no problem. No problem. My baby at the age of 5 complains of stomach ache most time when she's eating. What would you advise?
Okay, most of the time, children at that age actually normally complain of this pain, stomach ache, stomach ache. Sometimes it's normal for them. There's nothing you should worry about. They will actually outgrown it, except it's actually giving them a serious complaint. If it's not, you don't need to trouble yourself. Sometimes they just do it because they don't want to eat. Sometimes they can just actually say, I'm having stomach pain because they don't want to eat. But why some is actually they actually have that pain, but it's for them they will outgrown it as at that age. So you don't need to trouble yourself about it.
Okay. Also, if you notice that the baby is really crying, the stomach pain is so bad, then you might need to get the baby examined. Yeah. We have so many questions here on TikTok. Make una share this video now. People are not really supporting us like this. Please, how can I increase my ovulation? Dr. Israel.
First of all, you should ask yourself, do you know when you ovulate? That's the first question you should ask. Because if you know when you ovulate, you should know that ovulation is just once in every cycle. Just once in every cycle. It means that you cannot increase it. When you talk about increasing it, it simply means that maybe you are not ovulating. That is when you are thinking of having an ovulation. Maybe you are having, you don't ovulate. So you can what you first of all, as I earlier said, try to know, do you ovulate? So if you ovulate, you don't have any problem. The next thing you should be thinking of is how to have sexual intercourse within your ovulation period so that you can become pregnant if you are looking for a child. So that's it. So trying to say you want to increase your ovulation, I don't think you need it. So know your cycle, know your ovulation, because ovulation takes place once in every cycle. Once in every cycle. The only time you want to be thinking of that, it is if you are not ovulating at all. But first of all, do you know your ovulation? Did you know? Do you know? So if you know
Very
and you
good.
notice and you know that you are not ovulating, then you need to see a gynecologist. Yeah, they will prescribe some medications for you, do some investigations for you. Then you may not start seeing your ovulation as of that time. And be sure that you are not on any contraceptive pills, because on contraceptive pills or family planning, let me use the word family planning. Some family planning method can actually stop ovulation, and by stopping ovulation, I'm out of light, please. And by stopping ovulation, it means that some of you may not even be seeing your menses. Okay.
Yeah. So many questions. My God. Polycystic ovarian syndrome is not life-threatening. Oh God. Good evening, doctor. Please, anytime I drink alcohol, I always piss excessively. My brother, leave alcohol alone. To fly, make mango leave you. Leave alcohol alone. That's the answer I have for you, my brother. Leave alcohol. Okay, please share. We have so much question. Good evening, doctor. I have been having some kind of feeling around my calf. My sugar is good and my cholesterol is 202. What would you advise, Dr. Israel?
Sorry, please, can you come again with the question?
Okay, I have been having some kind of feeling around my calf region. The sugar is good, cholesterol is 202. What would you advise?
Okay, if the cholesterol is high and it's having some funny sensation or some pain sensation in the calf region, I you need to look for ways to reduce the cholesterol. You need to look for ways to reduce your cholesterol. So I think you need to leave fatty meal. You need to leave red meat, alcohol, smoking. You need to leave those things or reduce them as 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 you can. And also you also need to visit your doctor. Your doctor will also will tell you what next to do. Because those calf pain can just be due to accumulation of those of the cholesterol gathering in that place, reducing blood flow and all that. So you will help yourself by reducing those things I said and see your doctor.
Very, very important. The reason Dr. Isha is saying you should see your doctor so that you don't miss the diagnosis. We don't know if it was a doctor that advised you to do your blood sugar and cholesterol test. If your cholesterol is high, above 200 milligram per DL, you should be trying to reduce the cholesterol, you understand? But most importantly, see your doctor. It might be intermittent claudication. So many questions here. I always have miscarriage at the first 6 weeks of my pregnancy. Please, what's the cause?
Okay, if you're at the first 6, that's always, like the first trimester.
Always. What do you mean by always miscarriage? How many times, madam?
That's like the first trimester. So I will not be able to tell you the cause, because in first trimester, one of the cause of miscarriage in first trimester is just that maybe the body noticed that the pregnancy is not really forming well and they get rid of it. So it can also be an hormonal issue as well. Those are mainly the cause of miscarriage in the first trimester. So I would advise that you see your gynecologist so that it will do some investigations for you, and with that we know they will now know what next to do for you, maybe to prepare you before the next pregnancy. This bring to your notice that pregnancy is not just go have sex and become pregnant. You need to plan your pregnancy. Every woman are supposed to plan their pregnancy. You don't just become pregnant and you are shocked. Huh? I'm pregnant. No, you must plan your pregnancy. So in planning your pregnancy, you are supposed to see your gynecology even before you become pregnant. So that if there are anything that can cause such miscarriage, they will know on time and correct it on time even before you become pregnant. Yeah.
Thank you. We have so much questions, my God, and we are almost going to run out of time. Mr. Violence on TikTok, please, I beg you. You are troubling some people here. Please, I don't want to block anybody. Yeah, please stop. I beg. So many questions. Let's try to be very fast. Good evening, doctor. I used to have stomach ache at times. I have done series of tests, yet nothing.
So the next thing you want to find out is what do you do before you get the ache, and how is the ache, and when you say you are doing series of tests, who sent you for those tests or I don't know the kind of tests you did, but who sent you for those tests that you did? So it is very important to do the right investigation, because there are some tests you'll be doing which are not the right investigation. Just that it's like you just be doing your own thing. It's not like you're doing the right thing. So if you have not seen a medical professional, please try and see one so that they may send you for the right investigation that you do. And if there is anything really, they will also let you know. But if there's nothing, it can just be a somatic issue. Your mind playing fast trick on you, and then you need to retrace your step. Thank you.
Thank you. On TikTok, Ovignon, I see you. Adigun, I see you. Good evening, long time. You can follow me on Facebook. I'm very, very active on Facebook. I just come on TikTok once like that. I'm not really active. Somebody's asking us a question on TikTok from Magdalene. What can I do to have triplets? Please, madam, go to my YouTube channel. I dropped a video on YouTube, how to conceive twins. Go and watch the video there. It will help you understand. It will help you understand. Don't worry. Dr. Israel, somebody's asking us a question here. My God, somebody says, You skip my question. Sorry, we didn't skip your question, madam. We didn't see your question. Ajoke, sorry. Please, doctor, my children always complain of stomach pain. Ah, your children always complain of stomach pain. Your kids always. So, assuming you say it's just one child now, maybe. But if all of them complain of abdominal pain, always, maybe there is something in your environment, something they are eating, something that is causing them problem, all of them, giving them problem. Find out what is happening. When did this start? What is it tied to food, certain food they eat, or it just comes randomly? Now, if you know that you can't really get answers to all this, you should be speaking with a doctor because children should not be having abdominal pain almost at the same time. There is something causing them problem. You understand? Also, usually, do you have
Okay,
anything to
sorry, I
add?
want to add. Yeah. You also want to find how old are these children? That's another thing. Another one is, apart from the stomach pain, is there any other thing you notice? Are they going to toilet frequently, or are they vomiting? Is it that stomach pain it occurred the same time? And so you want to know all those stuff. But as we earlier said, if you're not finding anything, please visit your doctor.
So many questions, my God. Some of the questions you are asking us, we have answered some of them in our previous live sessions. If you are not following this page on Facebook, on YouTube, then you might be missing out. Some of your answers have been addressed before. Example, my period is not flowing very well. We have addressed this question about 3 times or 4 times in the last 2 months. Is it possible to be ovulating before and all of a sudden it stops? It's possible. Ovulation can stop. There are things that can make you stop ovulation, like anovulation. But you must know the signs of ovulation. You must know how to calculate your ovulation. You can't just assume. You must know all this. And yes, ovulation can stop in certain conditions. And somebody is asking us again, is it normal to feel pain during ovulation? Yes. And there are many other symptoms of ovulation. It's on YouTube. I have a video on YouTube. If you're not following me on YouTube, my dear, I beg you, go to my YouTube channel, Dr. Fredo Star. So many videos are there that will help you. Dr. Israel, we have a patient asking us here, I'm having ulcer, but I've been taking different drugs, but no changes.
Okay, Ajoke. What I will tell you about ulcer is that first thing first, you need to know the trigger factors. What triggers your ulcer? If you know what triggers your ulcer, then you want to run away from that first. Then that's one, because the treatment for ulcer is not just taking medications. Sometimes some lifestyle modification is very important in the treatment of ulcer. Two, now ulcer does not, yes, it can be treated, but it can reoccur, because when something is healing and it's not fully healed and you put something again, it can actually injure that place again, and it comes up again. That one is two. So you may be having recurrent ulcer, and you keep on taking medication. So that's why I first of all said you'll be thinking of modifying your lifestyles, and take some medication. I also think you will need to see a doctor, because there are some investigation. If you have money, there are some investigation you can actually do, endoscopy to be precise, so that they will see the extent of the ulcer and see what can be done to it. The endoscopy can be used to diagnose it and also can be used to treat it. Dr. Fred, are you hearing me? Dr. Fred.
Yes. So Israel, are you here? Hello, I'm back, everybody. Okay, good. If you can hear me, just say yes, I can hear you.
Yeah, I
Tell
can
me, let
hear
me know
you.
you
I
can.
can.
Okay, good.
Okay. So as I was saying, So with that, if sorry, okay, with that, when you find that the trigger factors and run away from it and modify your lifestyle, then take some medication, visit your doctor, very important, because as I earlier said, there's an investigation that can be done for you, endoscopy, which they look inside and see how the ulcer is. It can also be used to treat the ulcer as well, and can also be used to treat the ulcer. Also, there's some medication you are supposed to take for a period of time. Some of us don't take it. We don't complete the dose. We just take half of the dose and we leave it. When you leave it like that, it will reoccur. So are you really taking the complete dose of your medication, or you are just taking it for some time and you leave it and wait for another time and wait for another time of your painful episode and start taking medication again? So try to know your trigger factor and run away from it. I think that's a key point.
Okay, yeah, thank you. And also, I've made a video on ulcer, peptic ulcer disease. Is on Facebook, is on YouTube. For those on TikTok, sorry, you might have to follow us on Facebook. This network is not friendly at all. You said you have had miscarriage now 5 times. Please, see a gynecologist. See a gynecologist. We are about rounding up. Our time is almost up. What to do when someone come while romancing? Also, Israel, please answer this one.
Hello, Dr. Fred.
Yeah, please answer this one. Okay, the network is a little bit poor.
Yeah.
What to do? Okay, can you hear me now?
Yes.
Okay, the network is really acting up. What to do when someone come while romancing? You should not be coming while romancing. No, that is premature ejaculation. You might have to see a urologist to find out why. Because when you come during romance, it's abnormal. You get, yeah. You should
Is
not
it
be
a
coming.
lady or a guy?
Hello.
Hello, are you with me?
Yes, I'm with you.
Okay. I was asking, was it a lady or a guy that asked the question?
I think it should be a guy.
Okay, yeah, okay. Okay, that's premature ejaculation.
Oh, okay. We're about rounding up because of the network. Good evening, Doc. Please, what are the things to do when planning to get pregnant?
Okay, when planning to get pregnant, the first thing, you are supposed to see your gynecologist, let them know that you want to get pregnant. Then they may place you on some medications that can help, should I say, prepare your womb? Let me just use that word. That can help prepare your womb, and also that can help your hormone, and that can help your hormone as well. And also, you should also have regular sexual intercourse with your partner. At least we said in a week, 3 to 4 times in a week. Also, you should know your ovulation period when you are likely to ovulate, so that you can actually meet within those time. So when you are getting those parameters, and please eat healthy. It's very important. Eat healthy, so that it's not after pregnancy your PCV will now be very low. We'll start shouting, go and get this, go and get this. No, eat healthy. No, I said they will give you some medication. Those medications can also prompt you to eat, can also build up your immune system, your blood system, and all that. And also, if you have any other disease that is being treated, you should allow your doctor to know, so that they will know what, if it's to stop you off from that medication you are taking, or if it's to tell you, okay, this is what you should do or what not to do. Or if it's the one, they will tell you that, please, because you want to be pregnant, you must take those other sickness medication, you must take it very well. you will also know. That those are some few things you need to know or do before you get pregnant.
How long is the spotting going to last? Because it's disturbing me, though it's not heavy. Well, I can't really say how long the spotting will last. You don't have a time limit. I think your gynecology should give you an idea, but spotting should not last at all. It should end as soon as possible. Seeing blood while pregnant is not right. For about 2 years now, I have been having body itching whenever rain beats me. What do I do? My advice for you would be that you should avoid rain as much as possible. Avoid it because it might continue. What else do you want to add, Dr. Israel?
It's not its mind. Okay, yeah, okay. I think the word its mind may just be the best word. It's an allergic reaction. Allergic reaction actually does not have, in quote, does not have a cure. And the only cure to that is avoidance. Just avoid what causes it. You already know that it's only when you are beaten by rain that you have these body inches. So try not to be beaten by rain. Try to stay away from rain. So if you stay away from rain, you will not have it. And that's the cure already.
Okay. We're about rounding up. Few more minutes and we are done. Pregnancy without sex for 9 months. What happened? No problem now. Must you if you can have sex while pregnant, fine. If you don't want to have sex while pregnant, fine. It's your body. If you feel you must have sex while pregnant, okay, no issues. If you feel you don't want to have sex while pregnant, no issues. So Israel.
Yeah, pregnancy is not a contraindication for sexual intercourse. So because you are pregnant, you cannot say, I don't want to have sex again. No, it's not a contraindication, because if you do that, you may just be exposing your husband to so many things. Except maybe your husband is in conjunction to that, is what both of you agree to do. That's when you guys can take that decision. And also, if it's medically, if it is medically diagnosed, or should I say diagnosed? If you are told medically that okay, you should abstain from sex for a particular time, I don't think we always tell you to abstain from sex for 9 full months. No, I don't think we do that. But we can tell you to abstain for sex for some time. Yes, most likely. So first thing first, be sure that you are not the one that just want to stay like that. So that you will not push the other person to do things that you don't want to do. 2, if you know that pregnancy is not a contraindication, does not stop sexual intercourse, and you should know that.
Okay.
And 3, if it's not a medically advised stuff, please don't do it.
What causes hotness of the body, especially at night? We have one more question and then we are done.
Malaria.
Okay.
Dr. Fred, you can answer that.
If you're always feeling hot at night, every night, there are many things that cause that. When your body is having high metabolic rate, your body is producing too much heat, maybe kind of job you do, or you are having metabolic disorders. You can have increased temperature at night, and then there are certain infective processes. Now we are making any diagnosis for you. If you have other symptoms attached to this, you are having hotness at night, you are feeling weak, you are having body pains, you are sweating at night, you are losing weight. These are things that your doctor will need to see. But if it's just hotness at night, maybe it's the kind of job you do that's making you generate money. So take your bath at night and let's see if it will help you. The last question for tonight. Can ulcer be treated permanently? So Israel.
I think when I was talking about the ulcer at first, I mentioned, I said something about the treatment. Yes, when we talk about treating permanently, I will not tell you yes. I will not say a full yes, because you can treat it, but re-injure it, and the ulcer may reoccur. So treating permanently is not an 100% word I would want to use for you. So yes, it can be treated, but it can reoccur. And also, when a place, most of the time, mostly when it's within the esophagus area, when you eat, the food still passes through those places. And sometimes when you stress yourself or take some medication, it can still cause us more production of the acid in the stomach. And some of you will still go and do some fasting and all that. When you keep on doing all these many things, and the ulcer may reoccur and may come back, and by then you will not be it will not be cured, and it will not be cured 100%. But if everything being equal, if all other things being equal, yes, it can just be cured.
Thank you, everybody. Dr. Israel, I think we have to end it here. The final one I want to comment before Dr. Israel gives us the final comment. I have been receiving so many questions on my mail. I want to see you. I want to chat you. I'm sorry, ladies and gentlemen. Please, we don't do private chat or all this stuff. I don't give out my WhatsApp number. I don't know who's listening to me. We don't do that. We just come here and teach you. But for those that say they want to follow me and talk privately, you will book for consultation and you will pay. That is why I remove my number. But if you are ready to pay for my private consultation, please click on the link on my page and arrange. But if you know that you just want to call me and talk to me, I beg, I don't do that. It's very clear. Please, thank you for your understanding. Dr. Israel, your final words.
Okay, I want to say to everybody that health is wealth. So let's try and take care of ourselves so that we'll be healthy. And when we are healthy, we'll be wealthy as well. And also, I will not stop by saying this. 1st of December is World AIDS Day. If you've not tested yourself, please do. It is very important. And also, you should know that there are other testing modalities that you don't even need to see your blood. You don't need to prick yourself, which we call self-test kit. You don't even need to go to the hospital. Just go to the hospital, collect the kit, and go to your house and do the test. You only need to call us call the doctors in that facility to tell them the results, or the counselors to tell them the results. And based on the results, they'll follow you up on that. So please, let's stay healthy and be good.
Thank you, Dr. Israel. You can also follow Dr. Israel. That is his handle there. Yeah, this is his handle. You can follow him. How do I point now? Okay, yes, you can follow him here. This is his handle. This is his handle. Follow him, follow him, follow him. No. Okay, good. And thank you, everybody. Help us share this video. Tag your friends to come follow us and learn. We appreciate you. We are grateful. We appreciate all for your time. God bless you. Like I always say, good life. Good life.
Nonsense.
Nonsense. Take care and have a wonderful night. Bye-bye. Dr. Israel, thank you so much.
Bye-bye. Welcome. Yeah. Take care.